Along with breaks and abrasions, blood is an all-too-familiar sight at Northampton General A&E. What they don't see every day, however, is someone who's been bleeding out of their beak for a week. Someone like Roger Thurlow.
I suppose it did start on Monday morning when I went into the office, and it's now 8:30 at night on Friday.
It's been a bit of an eye-opener for Roger, I'm afraid.
Despite the blood-soaked bandage hooked under his hooter, managing Roger's discharge is a full-time job.
We're tearing bits off as Roger needs them, just to stem a little bit of the
I've got through one of those already today.
Roger's troubles began with a polyp, a build-up of hard skin on the inside of the nostril. The polyp was removed in a routine procedure, but a few days later, bleeding began. A nosebleed might not seem that dangerous, but Roger's at risk from some potentially nasty complications.
If a person loses a lot of blood, he can die from it, can die from shock and blood clotting problems. It's a potentially life-threatening condition.
With congealed blood backing up in Roger's nose and throat, Dr. Salvia knows what's coming and kits herself out accordingly. Her first job is to clear the blocked passages.
All right, you ready?
Yeah.
Okay, I'm going to take the bolster now.
I'm going to look away.
If, like Carol, you're a little squeamish, you'd be well advised to look away now. As the bolster comes away, a nostril full of congealed blood comes with it.
Got this?
Put this up.
And once the nose is hoovered out, Dr. Salvia's next step is to insert creamed packs up the nostrils to prevent further bleeding.
I'm just going to put this, and hopefully this would stop the bleeding. Okay.
Oh, right, so no need to cauterize anything.
Yeah, no need to cauterize or anything.
Right.
There's a white stuff, it's antibacterial.
Good.
Unfortunately for Roger, his throat is filled with more of these blood slugs. There's only one simple way to get them out, and it's not pleasant.
Can't stand the sight of blood.
Time for Carol, and anyone out there watching who's not keen on the sight of blood, to look away again.
Come it out. Excellent, well done.
It's horrific. Absolutely horrific.
That was it, Laura.
I can honestly say I haven't seen as bad on the horror movies. I mean, it was just phenomenal. It was like a large piece of liver. We then saw something rather like a whole slither of liver, wasn't it? I mean, it was just absolutely amazingly bad.
After a quick gargle and a rinse, it's clear the bleeding still hasn't stopped, and Dr. Salvia tries a new approach. Inflatable packs, known as nasal tampons, to keep the blood at bay.
Oh, God, straight.
Just relax for me.